Before starting our musculoskeletal case, we need to know that if we have multiple destructive bony lesions in multiple bones of the body, the main differential diagnosis should be multiple myeloma as primary tumor, primary bone tumor, multiple myeloma, and metastatic deposits. Multiple myeloma, its laboratory findings: monoclonal protein in blood and urine. So in multiple myeloma screen, blood and urine test will show monoclonal protein. And the bone scan will be negative for multiple myeloma, except for some pathological fractures. So on the bone scan of multiple myeloma, you should expect that the lesions will show negative uptake. However, there will be associated pathological fractures. Metastatic deposits, you will find multiple destructive bony lesions, and the characteristic finding here that these osseous lesions will be associated with deposits elsewhere in the body, like in the lung and the liver. So metastatic deposits, if suspected, will need CT scan of the lung and the abdomen to find the primary lesion and the elsewhere organ deposits. Also, metastatic deposits is highly suspected if you found that the vertebral body destructive lesions is not affecting the disc space, and the vertebral body destructive lesions is best seen in the unenhanced T1 weighted image. This is a characteristic finding on MRI. The destructive bony lesion is best seen on an enhanced T1 weighted image. It will not be seen on T2 weighted image or on the unenhanced T1 weighted image, only on the unenhanced T1 weighted image. It will be seen as low signal vertebral body lesions not affecting the vertebral disc space. The second finding that will be highly suggestive of metastatic deposit if you find destructive lesion in the iliac bone in an adult. So destructive lesion in the iliac bone of an adult is highly suggestive of metastatic deposit. Let's start our case. X-ray, single view of the lower leg. X-ray single view of the lower left leg, centered on the knee joint. Here is the key point. There is permeative bony change affecting both femur and the tibia. There is permeative bony change affecting both femur and the tibia. Multiple destructive bony lesions affecting multiple bones in the body. And there is associated periosteal reaction. This is the associated periosteal reaction. The associated periosteal reaction. Onion skin appearance. Onion skin pattern periosteal reaction. The appearance is concerning for an aggressive process. This is aggressive process. Permeative bony change and onion skin pattern periosteal reaction is concerning for an aggressive process. So the differential diagnosis here is this can be a primary tumor, multiple myeloma, or metastasis. If this is the first presentation, I would recommend a myeloma screen. Myeloma screen and a CT scan of the chest, abdomen, and pelvis with contrast for further assessment, as metastatic deposits are suspected. So I would recommend myeloma screen to detect the monoclonal protein and to detect the negative bone scan. And I would recommend CT scan of the chest, the abdomen, the pelvis, and the pelvis for further assessment of the primary tumor or elsewhere deposits.